All right, I am here with one of the stars of the show, Dr. Rangan Chatterjee. Doc, the first lifestyle medicine training ever endorsed by the Royal College of Physicians. You must be pretty proud of this moment.
Yeah, James, it's just incredible. I mean, looking at that room, there's about 200 or so people. We've got GPs, we've got specialists, endocrinologists, oncologists, obs and gynae docs. It's just absolutely incredible that so many people are here wanting to learn, and so far the feedback's been absolutely incredible.
Yeah, what's it like? I mean, obviously lifestyle medicine is palatable to practitioners who've never heard of it, but you're getting into some pretty, functional medicine type of stuff here. What's the way that we can bring doctors most easily down the road towards understanding this type of root cause approach?
Yeah, James, you bring a really good point, which is about labels. We've all got to have our little label about what we do, but as I've said to you many times in the past, this is about practicing good quality medicine, trying to get patients better using as harmless as possible an intervention. As I've said to you many times before, James, this is, it's not about labels. This is simply about trying to get our patients better. What tools can we utilize in as safe a way as possible to get them better? And that's what they're getting today. I don't care what you call this, functional medicine, lifestyle medicine, progressive medicine is what I've called it in my book, right? It doesn't really matter. This is good quality medicine. This is actually 21st century medicine. And the thing that these guys are going to realize today is that what we're doing so far in conventional practice, we're applying 20th century thinking to 21st century problems. And that's the fundamental shift that's going on in these people's minds today, is how do we do that?
One of the cool things that I'm really enjoying about it is that your book, The 4-Pillar Plan, is actually part of the structure, because ultimately you're facilitating people to help to implement the 4 pillars. So how do you see, obviously congratulations on the book, it's been such a massive success. How do you see, content is actually like a part of medicine now, right? And it's really interesting to see how do you bring that all together?
Yeah, it's a great point, James. Things are changing, right? We're in 2018. The way education is delivered, the way content is delivered, the way people are consuming that content is changing. And if we're going to stay relevant as doctors, if we're going to stay relevant as a medical system, we have to adapt with that and give content to people in a very novel and different way. I mean, I'll tell you, here, we're in this venue today, right? Yeah. What we try really hard to do with this course is make it different from any other course that currently exists, certainly in the UK, and arguably in many other places as well. We wanted a great venue, wanted a vibrant, modern venue. We wanted really good food. And what we tried to do is create a new template for people in the UK to go back in their offices, back in their doctor's surgeries on Monday morning and have a new template. Yeah. Does my 4-pillar plan, the principles I set out in my book, apply here? Yeah, it absolutely does, because that plan, those principles are they're the foundations of how you create good health. They're the foundations of how you also help people who are not doing so well. And although the book is written for the public, I tell you, the amount of doctors who have already contacted me saying they're buying it for their consultation rooms, they're already prescribing it to their patients, because it's not, what are we seeing now? We're seeing lifestyle-driven disease. Yeah. It's not doctors v patients. In fact, every doctor in this room, on some level, we are a patient. Yeah. So actually, those 4 pillars, for me, they're the foundation. They're the 4 things that we've got the most control over, that have the most impact on our health. Yeah. And people are fighting about the most irrelevant things. If you concentrate on getting those 4 pillars right, the bulk of what we see, in many cases, will get completely better, but it certainly will improve a lot.
One of my favorite things about today was one of the most annoying things for me about this functional integrated world is the bickering that goes on between certain groups about what diet's best. And I felt like today you really just put that to bed in a really powerful way. How important do you think it is to have real cohesion moving forward? Because ultimately we're all talking about the same thing.
James, right? I thought long and hard before I put that in today, because I know from interacting with some of these doctors on social media, some are very very active in the low-carb movement, some are very active in the low-fat, plant-based movement, but they're all here under the same roof, at the same course. Let's look at the reality. The reality is, 30, 40 years ago, we did not consider type 2 diabetes or ischemic heart disease reversible, right? Now, we know that that's simply not the case. These things are reversible. You have people advocating a low-carb diet, saying that's the way to do it. But you've also got people advocating a low-fat vegetarian diet. That's the way to do it. And if you look at the reality, different populations are having results. So as someone who's trying to deliver fully accredited education, I couldn't put my head in the sand and pretend that's not happening. I've got to say, well, what is a unifying theory that actually means they can all be right? And that's what I've tried to put forward today. And James, the key point here is, let's be honest. In 2018, more and more doctors, no matter what their preferences around diet, are saying that lifestyle not only prevents you getting sick, lifestyle can be the treatment as well. That's a great starting point. Now let's unify everyone, bring them together, so we can help our patients.
Absolutely. I'm really proud that, we've come here to make this functional forum, because ideally what I want is for the energy that was in this room and the energy that was in this conference for everyone around the world to know that this happened. Like, that's been a big thing that we've always wanted to do with the functional forum. Just by the people who have showed up, not just the doctors, but the radio and all these other people. What do you think the ripple effects of this day is going to be in the future?
Sometimes I just, over lunch, just hearing the feedback from people, I dare not think about the ripple effect, because in some way, today, what's going on in that room is a significant change in medical education in the UK, right? This wasn't happening 5 years ago. In 2018, we have got a prescribing lifestyle medicine course accredited by the Royal College of GPs. That wasn't happening 5 years ago. Something is happening in society. Something is happening with social media. Doctors, the public, other healthcare professionals, we are all talking about this. Yeah. I think the ripple effects of today could be huge. If people go and share their story with, if you're a doctor, you go back to your practice with your colleagues, with your family, with your practice nurse. We've got, people from, prominent radio stations here today, because they think this is a pivotal moment in medical education in the UK. Clearly, I'm a co-creator of the course, so it's very hard for me to say that. All I know is that we have tried really hard to put something together that doesn't currently exist. We've tried to simplify health. Yeah. We've tried to simplify patient care, but underpin it with really in-depth science. And I think so far, so good.
Absolutely. Well, it's been absolutely amazing to be here. Doc, congratulations on what you and Ian and Jez and Mike have put together. It's really a fantastic day, and I look forward to seeing the ripple effects. Congrats.
Thanks, James. Thank you.